Hi, in previous video we were discussing different activities performed by pharmacists at community pharmacy. Up till now we have discussed different tasks performed during prescription handling. Today we are going to learn about some other activities performed at community pharmacy. Next role performed by community pharmacist is the information for health professionals. Community pharmacist is responsible for helping healthcare professionals for any of the general inquiry about medicines. For example, he or she can guide about mechanism of drug action, its effects and uses. He can get help from helping materials available in hard form or in soft form. Moreover, he may also highlight his or others' knowledge using software already installed on computer system of community pharmacy. Community pharmacist is involved in the demonstration of new medical equipment and biomedical testing. He or she can provide either literature in this regard or physically can arrange seminars for such awareness. Community pharmacists can demonstrate how to administer insulin by insulin pen. For example, first step in the administration of insulin by insulin injection is to grab your stuff, that is alcohol pad. Second one is hand sanitizer, and third and of course the most important is insulin pen. Sanitize your hand with alcohol hand sanitizer. Here I want to mention that in one of our coming video we will be discussing some of the most commonly used hand sanitizer and how to prepare them at home. Now rub your hands together until they are dry. Go ahead by removing the cap of the pen and gently roll the pen between your palms to mix the component of injection. Then use alcohol swab to rub the ends of the pen to make sure the safety of the application. Remove the needle from packing and apply it to the pen by moving it clockwise. Now adjust the units according to your dose and have a safety check on the presence of any air bubble. You can inject the insulin on different side of body, but preferred site is abdomen away from belly button. Hold your pen like writing pen and inject at 90 degrees to the skin. Press the button on the pen and hold for 10 seconds, then remove the needle and properly discard it. Under the umbrella of education for healthcare professionals, community pharmacist is also involved in providing piece of information for drug-drug interactions. He is also responsible for the provision of information on drug-food interaction. Community pharmacist can support his statement by providing the evidence of such interaction at molecular level. He may provide information about absorption, metabolism, mechanism of action, and excretion of drug, which can be changed in the presence of other drug or food substance. In our previous video, we have discussed that how much these interactions are important. You can check the link of our previous one at the end of this video. Hope so now you are expert enough in drug-drug interactions after learning the most common interactions in your community. An immense research on different new and old drug molecules is going on worldwide. This may result in availability of new facts about such drugs. Delivery of such statistics in the form of research papers is important for healthcare professionals by community pharmacists. This information can be provided electronically or in the form of print. Now let's jump into another role performed by community pharmacist. A community pharmacist may be involved in health promotion of the patient. He or she can create some newsletter for the patients of the community. He can provide these newsletters electronically by emails, Facebook, or through websites, and further sharing may be done in local pharmacy newspaper. These informations may be on different topics, for example, heat shock or physiological approaches for the treatment of depression. Another way to educate the community for burning issues is the arrangement of classes. Health classes may be arranged in the waiting room of pharmacy or in some other community halls. These classes may be highlighted by general health issues. Community pharmacists may also arrange seminars and workshops for health awarenesses of general public. Such seminars and workshops may involve the talks of some healthcare professionals from other community centers. Another role performed by community pharmacists for patients is to guide patients about the home resident use of different medical instruments, devices, and kits, for example, BP apparatus and inhalers. Furthermore, the display of different charts, graphs, and flexes in community pharmacy is also one of the methods for information sharing, not only with healthcare professionals but also with the patients. Community pharmacist is also responsible to perform some other activities in pharmacy. He sinks his toes in patient counseling. For this, he initially keeps all the data of the patient in a sequential way and makes proper history profile of the patient. Then he uses all the professional tools to make patient compliant to the therapy. He or she can guide and make patient compliant about the use of medicine, why it's necessary to take medicine, how to take medicine, for example, right time, and what will be the possible positive outcomes of drug taking. Before you lose interest, I am ready to tell you that community pharmacist is also always ready to help get rid of smoking. He or she helps patient to inform about the use of nicotine gums and patches. Moreover, he also involves himself in patient compliance activity in smoking cessation. Community pharmacist is also involved in the compounding of extemporaneous preparations. This enables him to prepare formulations to the needs of individual patient. Beside the preparation of this medicament, he may also provide medical help in the form of these medical preparations and other medical devices delivery at the doorstep of old or chronic patients. There are some additional roles of community pharmacist also. There might be some conditions like some emergencies or epidemics where pharmacist is allowed to share information. He is allowed for counseling and even prescribing and performing some medical kit-based testing. Summarizing, there is long debate on the roles of community pharmacists and they are versatile in their roles too. Hope so you liked the video. Please like, share and subscribe so that you can enjoy all the coming videos timely. Bye bye.